My name is Najjuko, and today I will be the guest correspondent at the SWAAC ELSO, the 11th Annual Conference 2025. I will be introducing Dr. Ibrahim Fawzy. We are here to have him share his insights. But before we jump into that, I would like to ask you, how are you enjoying the event so far?
Oh, it's beautiful. It's a beautiful event, very well organized, a great team. It's amazing to network with all friends and new friends that we are making here, and fantastic. That's the way to spread the knowledge.
Amazing.
And we are coming together every year stronger.
Yes,
I love that. It's been fantastic so far.
I think that's good news for us, correct?
Yes. Absolutely.
Okay, so if we dive right into the questions,
Sure.
first question would be, what's the biggest challenge ECMO in trauma patients?
Yeah, the biggest challenge for ECMO in patient with trauma and polytrauma is to pick the right patient for the right treatment.
Okay.
Because one of the prognostication factor for traumatization is the severity of the brain injury. If they do have the brain injury, you want to get them on the right time, but also the right patient. So this is where I think the area for research in trauma will be focusing on to get the best out of the ECMO for this population. We've seen a good outcome overall from all many centers, but again, it's one limiting factor of the outcome is the severity of the brain injury, and how can we identify these patients early or to rule them out if they have a devastating brain injury.
So as a leader in the ECMO education, what do you think SWAAC needs to do differently in the coming years to spread the knowledge of ECMO?
Well, the SWAT also have been doing fantastic so far, and the chair of education at that point, Dr. Huda, has done amazing work getting people together. We are in the right track. And the right track is having more endorsed ECMO courses, do more, train the trainer. So we are doing one in Abu Dhabi here, which is great. We are planning to host one in Qatar very soon. The more we train the next educator and trainer, will help spread the knowledge and spread the more courses on the region, because we are one of the very diverse two continent in the SWAAC, in the ELSO, and large countries. Population is a very dense population, many centers, and yet we have a very few ELSO centers. So is number one is spread the knowledge, but also recruit more centers, recruit more countries, support more countries to develop their programs, and spread ACLS proper utilization across the board continent, Asia and Africa.
Do you believe that the education has been well received?
Absolutely. People are thirsty for education. It's just the sense of the numbers of a qualified trainer who can do that. So we need to definitely expand on train the trainer and train more educators, more endorsed courses, but also outreach to the countries who are struggling to start and help them out by providing them to join other centers who are already functioning, give them a scholarship, and help spread this knowledge for other countries to be able to get that knowledge. Yeah.
So third question. Yes. What has been one of the most valuable insights or discussions you've experienced at this conference so far?
Well, lots of learning points, lots of learning opportunities, and many things that touch my heart. One of the most is actually the most recent quote by Professor Bonnet, who is our godfather really in ECMO, that 10 years from now, from the research that would be conducted by all these great people, the patient and the family will not know how did they get this treatment without complication, but we will know. And it's just inspiration for all of us to continue to improve, to collaborate more in research, and to be able to treat our patients in a better way with less complication. So this has really touched my heart.
Oh, bless you. I can feel the passion that you have in what you do.
Yeah.
And last but not least,
Yeah.
you have one of the most successful pre-hospital ECMO programs in the region.
Yeah.
What would you advise for other countries who are looking to establish the same services?
Absolutely. So I think the question mostly about the after-hospital cardiac arrest CPR program. My advice would be every center really and country need to look to the resources, see what can be feasible. We don't need to copy and paste or do like what other centers doing. We need to see what do we have, what is the resources we have, how can we get the best out of our resources. And then the outcome is not in anyone's hand, really. We are not in a competition. We are working collaboratively, we are learning for each other, and it's a massive learning curve. In Qatar, we look to the resources we have. We had a recipe for a great national ECPR program for out-of-hospital cardiac arrest, and that's why we said, let's invest on that. Okay, let's push on that. And it's been a great success. We continue to improve, and hopefully we're going to continue to do better. And I just wish all the centers to be able to do that. Again, you have to look to what resources that you had and fit these resources appropriately to what you can. So it doesn't need to be copy-paste, but need to be, really integrating and cost effectiveness and utilize your resources in a more effective way.
So basically, would it be safe to say, if you were to go to Africa, you would basically tailor make the services based on what Africa would be able to?
Absolutely. A country like South Africa,
Yes.
a great team up there. Do you need out-of-hospital national ECPR program? No, there is much more pressing needs for many more things that is required. It doesn't mean that you don't need that, but there is more important thing that can be done with the resources that you have. And that's why people need to think, what can they achieve with the resources that they have?
Sir, I'd like to conclude and say thank you so much, Dr. Fawzy. Your insights and passion are just absolutely commendable. We thank you so much for taking out the time to share your insights. And hopefully we'll definitely see you in the next coming year.
That's a plan. Thank you very much.
Thank you.
Awesome.